Hello everyone, Ashley with Amare, and we are back. I know it's been like 2 or 3 weeks. We've had a lot of changes recently. We're opening up a new office, so things have been a little crazy. Haven't been able to record. But today we're going to talk about tummy tucks. Okay, so this is like the biggest mystery on the planet. I don't know why when you guys go to get surgery done, they don't talk to you about these things. So a lot of people, unless you watch the tummy tuck videos, I know Dr. Subio has one, he's really good at explaining a lot of the tummy tuck stuff. We'll tag him in, the description box, so you guys can go check him out. But he does a really good job of explaining what happens in the surgeries, what's getting done, things like that. So sometimes you can check him out on Snapchat. Some of the doctors Snapchat the surgeries and tell you what's going on so you can see an actual tummy tuck procedure. But guys, it's a lot. So I've had a couple clients this week and I've asked them, which is worse? What do you think the pain is worse, tummy tuck or lipo? And a lot of people say lipo. Why is that? Now you'd think because tummy tuck is a big surgery, a big incision, it would hurt more. So you're numb. Everything down there is being cut. You're numb. All your nerves are cut. You're numb. So what they do in a tummy tuck is basically pulling skin. So when you get lipo, you're taking fat out. But skin does not snap back like that if there's no elasticity. So stretch marks after a baby, after major weight loss, whatever it is, extra skin, you get, a tummy tuck for. That's what they suggest. Now, there are other things that you can do, like J-plasma, if you have a little bit of loose skin. But if you've got a lot where you can grab it, sometimes doctors will call it the apron of skin underneath, where it's hanging. You're going to want a tummy tuck. And a lot of times people shy away from tummy tucks because it's a lot of work and it's a lot of surgery, and it takes a while to recover and stand up straight, which we're going to talk about in a second. But I love tummy tucks. The other thing that comes along with a tummy tuck sometimes, depending on how far down they pull, is a new belly button. So shapes, sizes, depth of belly buttons can all vary, and we're going to talk about that too. So what is a tummy tuck and why does it not hurt as much as lipo? Now lipo you feel a lot because you get sore afterwards. You feel everything. You feel your recovery. When you get fibrosis, you feel it. It's hard. It hurts. That we know about. Lipo's, a general thing that a lot of people do now. Tummy tucks, they are literally taking your skin, cutting an incision, pulling your skin down, cutting off the excess, and then stitching back the new beginning of the skin and the new end of the skin. So when they bring that together, sometimes you will get a mini pelvic lift. So the whole pelvic area will kind of lift a little bit because they are pulling it together. Sometimes they can do that, sometimes they can't. It depends on your doctor. So there are a lot of different things. So there's the standard tummy tuck scar, which is usually hip to hip. So it ends right on your hips. Then you've got the mini tummy tuck scar, which is really low. It's right over your pelvis. It doesn't go hip to hip. That's usually for skin removal. Or if you only have a little bit of extra skin that they're pulling down. When they do a tummy tuck, it's usually a lot more. Sometimes, going on the more heavy end of things, you will have a tummy tuck scar that goes past your hips, so it wraps around. Now, you guys can see all of these in our before and afters on our Instagram. Scroll through, check them out. You'll see some of these scars where some of them go hip to hip, some of them go around. When you look at their side profile, you'll see it comes around the side of the hip. There's also something called a lower body lift, which is where the scar is literally 360, and I'm not sure. I think that might be coming up on our Instagram before and afters if it's not there already. But it's 360 around, and they cut you all the way around and they pull all the skin up and down together to lift everything. That's a little bit more of an intensive surgery. I don't know a lot of doctors that do that. I do know a few that are really good at it, but that's a lot. So from one end to the other, we've got a mini tummy tuck, a regular tummy tuck, which is hip to hip. Then you've got the one that comes around a little bit more if you have extra skin on the sides. Then you've got the full body lift, which is extra skin all the way around the torso. So standard, we usually just get a regular tummy tuck. A lot of times, a couple things that go along with that. Ab repairs. So abdominal distension. What is that? Well, the ab wall is like this. When you have a baby and it rips, it becomes like this. And then there's sometimes like this where it's completely bulging. So everything in here, instead of being tight, winds up like this and separated, or it's completely ripped and you have a space in between. So we've seen it anywhere from just the top to the entire abdomen that has to be stitched together. So what they'll do is a corset stitch, which is where they have a corset, the stitch on top, and then they go back and forth along the abs and pull, and it pulls the abs together. Now, not all doctors use that. Most doctors do, from what I've seen, the doctors that I've seen in my experience, but that's how they do that on the inside. They pull the abs back together so they heal nice and strong and tight. That is one of the things that contribute to you leaning over and being hunched over for about 4 to 6 weeks, sometimes maybe more, sometimes maybe less, depending on what you're getting done and how much. So that's one thing. The other thing is the actual tummy tuck itself. Your skin is going to be very tight. It's supposed to be. You want to heal tight. You want all of that stuff to heal nice and tight so that we're pulled together and we are good when we're healing and we're not, you know, making sure that it's not too flabby or anything like that. That's the point of a tummy tuck, right? Is to get rid of all that. So let's talk about the belly button. We've got the skin, we've got the ab repair, your belly button. How do they do that, right? How do they create a new belly button? Your surgeons don't really answer all these things. Dr. Subio has a wonderful video on this, but basically, they don't cut your belly button off and move it. That's not how that works. So here's your stomach. They will cut here. They will peel it back. They'll cut a hole before they do that right here around your belly button. Your belly button stays attached to your body the whole time. So there's like a tiny little hole here, and they cut this, and because this is already cut, they peel the skin back, and now you have a hole here, but your belly button is still here on your body, attached. So that stays there, they just peel the skin back. So that way, when they cut and they pull back down, when they say they make a new belly button, sometimes, depending on how much skin, if they're pulling that much skin down, that little hole they made is getting cut off. I've seen that, where it's like that much skin that you're taking out, you need a whole new belly button. So what that means is they will now create over that skin a new hole for your belly button to come through. That's why you have stitches in your belly button, because they will stitch the belly button that's attached to your body to the skin and make a new belly button. So let's talk about this whole shaping a belly button thing, which is positively ridiculous that I hear all the time. You don't shape a new belly button. You had surgery, the belly button is the way it is. The way it heals is what we're shaping. So that's totally different. The reason you shape a new belly button, I see people sticking marbles and little like toy like balls and things like that. Like I've seen all kinds of stuff in the belly buttons, guys. If you want a natural looking belly button, the best way to do that is use something soft. Let your body go naturally. Use sometimes a cotton ball, but the fibers of the cotton ball can sometimes get stuck to your healing and your incisions and your things in there. Go by what your doctor recommends. See what he says. I personally, and this sounds ridiculous, I personally love using the very, very soft toilet paper because it's not as fibery as a cotton ball and those fibers won't stick to what's healing. But again, don't use anything, don't touch anything, don't do anything. This is after it's healed. Then we worry about getting the swelling out of your belly button. Because what makes it that thin, thin shape, so you'll see belly buttons that look like this. You'll see belly buttons that look like this, where they're like super, super tiny. What causes that is all the swelling on the inside. So if we put a cotton ball in there, it'll soften and get to like a normal shape. When they're like this, it's most likely your garment that's squishing the crap out of your stomach and your belly button's healing like that. So yes, putting something in there would help, but also get rid of the swelling. Once you get rid of the swelling, lymphatic drainage, manual lymphatic drainage massage, what you guys come in for, once we get rid of that swelling, everything will heal naturally the way it's supposed to on its own. So sometimes doctors can reshape your belly button. If you have an outie, they can make it an innie. If you don't like how small it is, they can make it bigger. If you like how big it is or don't like how big it is, they can make it smaller. Talk to your doctor about that. That is something you can talk about. So that's surgery side of it. But if your doctor, you talk to him about it and you still don't like the way your belly button looks, it's most likely swelling and we can totally fix that. That is an easy, easy, easy fix. So that is get the swelling out of there, make sure you're in a proper garment, and we'll figure out everything else after that. That's the belly button thing. So let's talk about something else I hear super common all the time, the dog ears or the saddlebags. That's this stuff like on the sides here. They'll cut. So when they do a regular incision, a lower incision for a mini tummy tuck will be here, right by the pelvis. A tummy tuck scar will be here, right by the pelvis, but like longer. And then sometimes they'll go all the way around to the hip to get this side if you have extra skin hanging off your hips. They will cut here and sew you, and your incisions will end right here. That's mostly what I see when people need a tummy tuck. It's that much. It's all the skin, hip to hip, completely, sometimes a little bit around the hips. So with that, one thing that everybody has a problem with is the love handles or the saddlebags or the dog ears. I hear a million, and doctors use these terms. I hear a million different names for it, but it's basically the swelling that comes back on the side here. Guys, that is not fat. They lipoed that out. It is gone. They cut you. They gave you a scar there. There's no way in hell it's fat. That is insane. That is not fat. That is not fat. That is swelling that will stick and hold on to your hips for dear life for the rest of your life if we don't get rid of it, which makes our garments and our phones even more important. We have a whole video on garments. Please go watch that. So That is not fat. They got rid of it. There's no more fat. That's not possible. So a lot of it is, again, healing. We can fix that. We can get rid of it. We can help with the shape. But a lot of times with a tummy tuck, the swelling and the lymph fluid will cling to that incision because it's trying to heal the area. So you'll get on the side here rippling. And we do have some pictures of this on our Instagram. Scroll through the before and afters of our tummy tucks, and you'll see that there are a lot of them that have like rippling on the sides when they first start. Their scar isn't flat. It's like bumpy or wavy, and then in their after pictures, it's completely straight. So that brings us to scars. We have a video coming out in the next couple days on the products that we use for scar healing and wound healing. A scar for a tummy tuck, the best way to prevent it is not have it to begin with, which means make sure you're using whatever wound care your doctor provided. If you don't have one, we have an amazing wound care ointment that we love. That stuff is magic, and it makes sure you don't even scar to begin with. Like, you don't even get a scar to fix. So the best way to fix a scar is not have one at all. And that is possible depending on how you heal. It should heal as a thin silver line, and then we can work on that if we want to. Guys, do not use any scar stuff on your scar until it is healed. If you use scar stuff that moistens your scar or your incision that still has a scab or that's still super red or super pink, it will become a permanent part of your body and do the reverse. If you start using a scar ointment or scar tape or something like that, and your scar starts to look purple, and we do have, like I said, a before and after of this, where like it looks worse before than it did, like it looks worse after than it did before, where you put the scar tape on, you take it off and it looks purple and deep, that's not good. That means you put it on way too early, or whoever told you to put it on way too early. That should not happen at all. So please make sure that if you're going to use scar things and not consult us first, make sure that you are fully healed. No scabs, no ridges. You shouldn't even feel the incision at all. Then use the scar stuff. Scar stuff is specifically for lightening. Scar tape can sometimes smooth it out. But a lot of that bumpiness that you're feeling is lymph fluid that's stuck underneath, unless you have a problem where you're prone to keloiding. But even then, if we work with you before that, which I would highly suggest that we do if you have a problem for keloiding or fibromyalgia or autoimmunes or things like that, you're going to swell more. So your incision is going to be worse necessarily, but we can get rid of that and we can make that go down. So please do not use the scar stuff unless you are healed. That's how the tummy tuck scar turns into a monster and a nightmare. It's reversible, we can fix it, but your body's gonna have to take a lot longer to heal. So that's the belly button, that's the scar, the little dog ears part of it that everybody complains about with a tummy tuck. Let's talk about recovery. So what does it mean to recover from a tummy tuck? Well, you can't lay on that. Laying is kind of hard because you can't lay flat on your back because you're gonna be pulling. If you had an internal ab repair, you're really gonna be hunched over for a while. The worst thing you can do, and I get that this is the mommy makeover thing, but I would really, really suggest not doing this, a BBL and a tummy tuck. It is the worst combination in the world. You can't sit on your butt, you can't lay on your back, you can't lay on your stomach, you can't lay on your sides. It's a horrible recovery. So if we're gonna do one, do one. If we're gonna do the other, do the other. Now, we help people through tummy tuck BBLs all the time. We make it a breeze, but does it take a lot more lymph sessions? Yeah. Does it take a lot more work? Yeah. Does it take a lot more post-op sessions with me for counseling? Yeah. But we can get through it. So if that is your only option, do that. If we can kind of space them out, space them out. But recovering from a tummy tuck. So garment is the number one thing. You will not be comfortable unless you have a proper garment to hold you. You are literally cut in half. You need to make sure you have foams and a garment and you're getting drained, because the more fluid we get out of your abdomen, the more comfortable you're going to be. It's literally the center of your body. You're breathing, you're eating, you're sitting, you're sleeping. It's all going to be affected. So lymphatic drainage, number one. Number two is your garment and your foams. Number three is make sure you have a proper place to rest or sleep. So sometimes they say a recliner because you can hunch over a little bit. Sometimes on the couch if it's more comfortable than the bed. Do your research, see however you have to do it to make sure that you're going to be able to sleep properly. Because if you're not sleeping properly, then you're not recovering properly, and it's this big problem. So sleeping is the number one thing. Also, taking care of your wound, which we kind of talked about already. Use whatever your doctor gave you or contact us. We have wound care stuff. We're going to do a video on that this week. It might come out on Monday, actually, that video, because we're also going to do a giveaway with it for all of the products that we talked about in the video. So wound care is number one with that. The quicker we can heal that, the quicker we get those stitches dissolved, the better it is for your body. So that's definitely a thing. Also, making sure that you're not doing anything strenuous. I know that seems like, oh, well, yeah, obviously, I just had a tummy tuck. Guys, no. Like, seriously, no lifting, nothing. So that's really it for recovery. But I will talk to you guys again soon. If you have questions, reach out. Bye.